So the first exercise I'm going to show you is the hip and knee bend. So you're told with this exercise to hold on to something. So I'm going to stand up, you're going to lose my face. And all we're going to do is just lift the knee up and down. We're just trying to get that movement there. Now the problems we often get, that I often see, even in general classes, is that people either hitch the hip up as they do that and lean the weight totally into the other side, or they let the hip drop out to the side. There are all sorts of things that you can do. So really be aware when you're doing these. Hold on to something to start with that's the right height, maybe a chair. So I'm going to bring this chair around, make sure I've got space at the side, keep my hips against the front of the chair and lift and lower. Alright, I might need to be a little bit further to the side so that I can easily do that exercise and support myself so that my weight is evenly distributed across my pelvis, across this area. This exercise you'll hear as hip extension, which is where we lift the leg out behind. Exactly the same sort of thing. Make sure you've got a support that's the right sort of height so that you're comfortable. And all you're going to do is take the leg straight back. Now what we're trying to work here is the muscle here in your bottom of your bum. You're squeezing it back. It isn't a big movement. Now quite often what people will do is either lean into the side, fold forward, in which case they're just working like a nodding dog. You need to be taking that leg straight back and feeling it working here. The squeeze and release. Trying to keep your pelvis, so again across here, as level as possible. If you lean against a worktop or your chair, you can take that and feel that your hips are level. I haven't got an ideal chair here, but if you can find something that's the right height, you're going to feel that you're keeping this as level as possible. So this exercise is hip abduction, which is taking the leg away from the body. You're going to start with the feet directly under the knees and ankles, as before, feet pointing forward, keeping the head upright, and you're taking the leg out to the side. Now the main problems I see with this exercise are, I'm going to do it without any support, is leaning over to the side, leaning out to the side, turning the toes up, which means you start working this muscle instead of the one we're aiming for. So that's the main issues we see with that exercise. The exercise we're going to talk about is mini squats. With this exercise, all you're going to do is watch, first of all, that your feet are pointing forward, directly under your hips, and sit back as if you're sitting into a chair. You're going to try and keep your body upright. You almost definitely will lean forward, but try not to. And just go back as far as you can. You need to hold on to something secure here. Worktop in the kitchen is really good because you can hold on to it securely and come back up. So here, the things to watch for, the feet aren't turning out so that you're actually working the right muscles. You're securely holding on to something. Again, probably about this height would be good. I'm just holding what I've got here and sitting back, trying to stay upright. Now if you look at my knees, I'm keeping my knees above my ankles as best I can, so my knees aren't going forward here. You don't want to be doing that, you want to be keeping them back, and you don't want to go more than 90 degrees. In reality, you're not going to do 90 degrees.
The next exercise, I can't stress how important it is. You've been in hospital for a few days, you're in bed more than you would be, and your ankles are getting a bit puffy. So we need to get the calf muscles moving. The calf muscles are the only way the blood gets back to the heart. So if they're not functioning and pumping, then you're getting swollen ankles. 1. 2, it's very easy to not work that extra bit. But if you don't get this up on tiptoes back, you will just get weaker and weaker, and this is how you trip over your feet, the mat, going up the stairs, down the stairs, because you cannot control what your foot and ankle is doing. So yeah, I can't tell you enough.
Tracy said, I'm going to talk you through the exercises, how you can make the exercise a little bit easier, and also some of the mistakes people make. What I want you to make sure you do before you start the exercise is, first of all, make sure you've got something to hang on to. Worktop's usually a really good height for somebody about here. If not, a chair is fine too. I want you to make sure your ankles are under your knees or under your hips. You're going to try and keep your head up, so don't look at what you're doing, apart from check that your feet are pointing forwards, not sticking out, so that you're perfectly aligned. If you can, have a mirror in front of you as well. Now this is going to be a little bit awkward if you're using a worktop, but have a look, do it both ways, okay? So I'm going to start off, it's the easiest thing you can do to get yourself ready for this, which is just lifting one leg, lifting the other, and try and get the heels to the same height both sides. Once you can do that comfortably, which most people should be able to, you're going to then change to alternating between the feet, up and down. And eventually, lifting on both feet, keep the head up, keep the balance of the weight directly above your body. That way you're not going to fall over. This is really good for strengthening the calf muscles. If you have slightly weak ankles, you're going to struggle a bit more with this. Again, when I'm doing this, I'm coming up a long way. If you can't go that far to start with, just lift up and hold for a short while and take it down. And try and gradually get that movement as high as you can.